ordering 10 to 15 million doses of Gamaleya's Sputnik V. And according to Secretary Carlito Galvez, 2 million doses of Sputnik V vaccine may arrive in the Philippines next month. Riza?
How about updates, Greg, on the EUA of Moderna, and has Sinopharm applied for EUA already?
Riza, according to FDA Director General Eric Domingo, they have met with officials of Moderna last month, but up to date, there are no applications yet submitted by Moderna. While as for the Sinopharm, Director General Eric Domingo said there are two entities who submitted a letter of intent for an application to EUA, but as of now, none of them has replied according to the requirements needed for the EUA. Riza?
Finally, Greg, regarding Sinovac, do we have confirmation if it can be given to senior citizens?
Riza, under the current emergency authorization given to Sinovac, it may only be given to 18 to 59 years old. But according to FDA Director General Eric Domingo, once Sinovac submitted an evidence to FDA that says Sinovac may be used safely to elderly or senior citizens, they may review it and revisit the current EUA. Riza?
Are there any other points that was discussed in today's briefing, Greg?
Yes, Riza, Director General Eric Domingo reiterated the agency's advisory against those unauthorized selling of COVID-19 vaccines, as there are only approved emergency authorization given to a number of vaccines up to this date. No commercial sale of vaccine is allowed. FDA Director General Eric Domingo also reiterated their advisory against certain cosmetic brands with unauthorized selling of a number of products. Domingo said if these brands will not recall their products, they will order seizure of these products. Riza?
Thank you for all those information. Greg Gregorio reporting from Marikina. The OCTA research team is projecting daily COVID-19 cases in the country to average at 4,000 to 5,000 by end of March. That is if the country fails to control the transmission of the virus. To give us more details and updates on numbers, we have with us Jen Calimon. She's reporting live from Malabon. Jen, how rapid is the current rise in cases according to the OCTA research?
Well, Riza, I will start with numbers. The OCTA research made a comparison on the data they gathered from March 5 to 11 versus the data they had from March 12 to 18. For March 5 to 11, the average new cases per day is 1,543. For March 12 to 18, it is now at 2,477 average cases per day. The reproduction number remains the same at 1.92, but the daily attack rate before was 11.03. Then after a week, it increased to 17.71. Positivity rate now has increased to 14% compared to 10% during the first week of March. They are also projecting 4,000 to 5,000 cases per day by the end of March if we cannot control the transmission. But Riza, they are optimistic that with the localized lockdown, these cases may be decreased to less than 4,000 cases per day. Riza.
Surely hope that. But what is the latest, Jen, on the data on hospital occupancy? Do they see it as concerning, and what are the projections?
Well, Riza, the hospital beds occupied is now at 3,590 compared to just 2,949 a week ago, and the ICU beds occupied is at 721 compared to 389. In terms of occupancy, the percentage was not that much because we added more COVID-dedicated ICUs to prepare for the surge. But if we really cannot prevent the spread of transmission, the OCTA research is projecting that bed occupancy will reach 5,200 or 80% bed occupancy by April 10, thus overwhelming our healthcare utilization. Riza.
Well, you mentioned the government is convinced that granular lockdowns are still the best solution to the rising cases. Does the OCTA research team agree to this, and are they recommending additional restrictions?
Riza, the OCTA research said that a granular lockdown may not be effective. Thus, they recommend that a breaker lockdown may be implemented to control the spread of the transmission. They are suggesting to implement a hard GCQ like what we had in September. Hard GCQ means having curfew and more mobility restrictions. To be more specific, under hard GCQ, government and industries can continue operating with a significant percentage of workforce allowed to work through various work arrangements such as work from home or staggered work hours. Social gatherings shall be discouraged during the duration of quarantine. Certain activities in enclosed areas shall also be discouraged, but restaurants can still be open to customers, but for takeout services only. Quarantine pass shall be given to workforce only, and mass transportation shall be available for all workers during quarantine. If this hard GCQ does not work within 2 weeks, a soft MECQ may be implemented as breaker lockdown according to OCTA research. Riza.
We're hearing, Jen, reports about ongoing surges in other countries as well. How do their quarantine measure compare to ours?
Father Nicanor Austriaco said that there is an ongoing surge in the world, like in Czech Republic, Hungary, and Estonia. All of them began their lockdown last week to prevent the healthcare infrastructure of these countries from being crashed by COVID-19 load. Father Austriaco is suggesting that we can also imitate what these countries did and implement a lockdown in our country by reducing the mobility of the people. Riza.
On the economic side of things, Jen, how is the current COVID-19 situation expected to affect the country's economy?
Riza, according to Janine Lazatin of the OCTA research, the Philippines suffered the worst recession in several decades, and we've seen these effects last year. For 2019 to 2020, our gross domestic product fell by 9.5%. Our household and financial consumption expenditure fell by 7.9%. 4.5 million Filipinos were unemployed, while 6.4 million Filipinos were underemployed. But on a lighter side, Riza, growth prospects for 2021 are positive, but it is subject to risks. This positive projection assume continued resumption of economic activity, but it can also be disrupted by the resurgence of COVID-19. That's why it is very vital to prevent the surge as to prevent the negative effects of this pandemic in our economy. Riza.
And more vaccine supplies are expected to arrive later this month and in April. Are experts, Jen, optimistic that this will somehow support the economy in the near future or at least slow down the rise in cases?
Riza, the OCTA research said that vaccination is just one thing. They insist that the government must do other interventions, such as strictly monitoring and enforcing compliance with the minimum public health standards, accelerate the vaccination of our healthcare workers, and fund the improvement and expansion of biosurveillance in the country. All of these recommendations, Riza, would be of help to somehow control the surge that we are experiencing right now.
Thank you for those updates. That was Jen Kalimon reporting live from Malabon. European regulators say the AstraZeneca vaccine is safe despite reported cases of blood clots among some recipients. The Philippines is also set to receive more AstraZeneca shots later this month. The question now is, would you be willing to take the vaccine? Let's hear answers from people from around the world in this Bloomberg report.
E lei se lo farà comunque adesso il vaccino, se la chiamano di nuovo?
Sì, ma penso che potrebbe anche cambiare.
Non lo farò mai.
Perché?
Perché non ho fiducia nei vaccini. Perché lei sa quanto che contenuto c'è nel vaccino.
In the United Kingdom, we had millions of vaccinations already, and overall they are not really problematic. So I still believe it's safe to take this vaccination.
Că sunt riscuri, pentru că produsele, orice medicament care există în mod curent și este folosit în domeniul la care se aplică, vine supus multor teste și dacă în continuare vine folosit, înseamnă că nu este niciun risc.
I know there's a lot going on in the press at the moment about the AstraZeneca, but I wasn't concerned at all about having it done.
No, I'm not afraid. I will do the vaccine because I want the certificate that it permits you to travel.
I think that any vaccine is better than no vaccine, regardless of the measures that we take, like wearing a mask or keeping social distance.
In een half uurtje getwijfeld. Gisteren, als ik dat hoorde.
And those are the top stories of the hour. Join Sean Yao later at 2 in the afternoon as we continue to monitor the day's biggest stories. You can also catch One News on Signal Play. Register for a free account now at www.signalplay.com and stream One News live anytime, anywhere. I'm Riza Diaz. Mask on, wash hands, and stay safe, Philippines. We are One News.